Hi, today we're going to talk about supplements for PCOS and pregnancy / trying to conceive. I see a lot of information out there about supplements that can help you have a baby, make a baby, grow that baby. And one thing that I think is really important when you're talking about fertility and conception is to make sure you're taking stuff that wouldn't harm your baby. Because if you're like most women, you don't know you're pregnant the moment you're pregnant. You might be 1 or even 2 months pregnant, especially if you have PCOS and you're used to missing a period. You may not really clue into the fact that you're pregnant for a while. And if you are taking supplements that aren't appropriate for a pregnant woman, then, you just don't want to have that kind of like worry on your head in your mind throughout your pregnancy. Speaking of babies and pregnancy, if you hear my baby crying, she's with her grandma. I'm not ignoring her. I just got to get this done, so she's just a little fussy today, but grandma's loving on her, so don't you worry about my baby girl. Okay, so the first thing I want to talk about is just if you are thinking about becoming pregnant, you should start taking a multivitamin that is for trying to conceive, or just even a regular prenatal vitamin. I particularly like the THERALOGIX brand of prenatal vitamins because they have a trying to conceive multivitamin, and then they move on to the prenatal vitamin, and then they have, after you have the baby, they have a lactation vitamin, which is awesome if you are lucky enough to be able to breastfeed, because it gives you extra vitamin D that you pass on through your breast milk to your baby, because young infants are often, your pediatrician will ask you to supplement with vitamin D, and it's much easier to just supplement yourself and give it to them through the breast milk than like mess with dropping little drops of vitamin D into their formula or whatever. Okay, so first thing is a preconception or prenatal vitamin. You want to take it. The next supplement I want to talk about is fish oil. Now, fish oil in some studies has been shown to reduce androgens and testosterone in people with PCOS. It's also shown to be anti-inflammatory, and it is cardioprotective. It prevents or protects the heart from heart disease. So all 3 of those things are fantastic for people living with PCOS because we struggle with preventing heart disease, high androgens, and inflammation. And if you happen to be pregnant, you're going to need a lot of those omega fats to help build your baby's brain and eyes. And in fact, in studies, I don't remember where, I can't find a link right now, but moms, after they give birth, they are kind of low on omega fats in their brain because that's where most of your omega fats go. So it's good to have like a good store of those before you become pregnant, and then to keep that reservoir up during pregnancy and then after pregnancy, because low omegas are associated with mental health problems like depression and I believe maybe anxiety. So those are other issues that people with PCOS suffer with. So having a high quality fish oil. Now, if you're thinking about having a baby or you're already pregnant, you want to pay attention to where you get your fish oil, because you do not want to get it from cheap sources where they might have high mercury, untested, screened fish oil. I like Nordic Naturals, and again, the THERALOGIX brand, because they're tested for purity, and they have NSF or GMP certification, which is what you want to find on all your supplements. That means that a third party has come in and tested their facilities to make sure they're up to snuff. And so an alternative to fish oil, if you're a vegan, would be algae oil, and that will also help supply you with the necessary omegas you need to make a baby and stay healthy postpartum. Now let's move on to a mineral I love to talk about, magnesium. So magnesium is great for a lot of things, but in particular pregnant mamas. It can prevent or at least alleviate 2 big pregnancy complaints. The first is first trimester morning sickness, and the second is leg cramps that usually show up while you're sleeping later at night. And if you take magnesium at night, it's kind of a down regulating mineral. It helps you relax, and it's great for also for PMS. So if you're just ovulating and not trying to be pregnant, it is great. Again, you want to look for a high quality source, and I'll put the dosage recommendation. You want to ease into taking magnesium. Pay attention to how much is in your multivitamin, and you don't generally want to go over 1,000 milligrams in a day, I believe. And so you don't want to take too much all at once, because in some people it can create loose bowel movements. So, don't want to be surprised by that one morning. All right, and let's move on to insulin sensitizing supplements. 2 that are safe to take throughout pregnancy and have a robust amount of research proving that they're good for pregnant people to take are inositols and NAC, both of which are known to improve egg quality and fertility and reduce insulin resistance in people with PCOS. So they're great for everyone with PCOS, but also they're safe for pregnant people who have PCOS. And there's some research to suggest that taking inositols during pregnancy can ward off gestational diabetes, and that is a temporary diabetic state that occurs when you are pregnant. And those of us who have PCOS are at higher risk for gestational diabetes. So I highly recommend talking to your obstetrician about the possibility of supplementing with either inositol, NAC, or both throughout your pregnancy. But again, I am not your doctor. I am not a doctor at all. So this is just education and information that you can take into your clinician's office so that you guys can have an open, honest, and educated conversation about some of your options when it comes to nutrition supplements. And now I want to talk about 2 popular PCOS supplements that are not safe for pregnancy. And that is berberine and Vitex. They are not recommended for pregnant people. So if you are taking those and you're thinking about having a baby, you should probably talk to an herbalist or your physician or your obstetrician, someone who knows more than you or I about whether or not it is wise for you to continue taking those. There may be situations where it is appropriate, but as far as a general rule of thumb, especially if you are taking these 2 herbs without the supervision of someone who is trained to supervise you in taking them, they're probably not a good idea for you to take if you're trying to conceive or are already pregnant. So you would want to discontinue that. Overall, any supplements you take during pregnancy, you want to make sure that they have a third-party certification. The ones in the US that are most common that you will see on the bottle are GMP and NSF. As I said before, those are independent companies that are paid to go in and make sure that the manufacturer of that supplement is putting in the bottle what they say is in that bottle, no additives, no faulty manufacturing processes. So that is of the utmost importance when you are pregnant, because you don't want to be taking something random and passing it on to your little bundle of joy. Another question that I got recently, and I'll just jump in here and add this, is protein powders. Again, you want to look for NSF or GMP certified protein powders. I'll link to it here, a whole thing about protein powders and PCOS, a whole video. I recommend vegan, hydrolyzed beef, or collagen peptides as far as protein powders go. And they could be a good tool for those of you that are in the first trimester and are feeling really yucky. You might be able to get down a smoothie. I could drink a lot of strawberry smoothies when I was pregnant with my kids, and toast. And that was it. So yeah, that was a good way for me to get in protein for a few weeks while I was hating every other food in the world. It's worth it though. All the nausea is totally worth it. It's so much fun. So if you want more tips on how to have a healthy, awesome pregnancy and motherhood experience, if you want more tips on how to thrive, work out, and feel your best self, even though you have PCOS, because it is 100% possible to feel awesome even if you have PCOS, Click subscribe here because that's what I'm all about, sharing actionable information that you can trust on PCOS.